New this morning, new data has been released examining child welfare well-being across the state of Michigan and in local communities. It's part of the annual Kids Count data released by the Michigan League for Public Policy. 13 News Side's Veronica Ortega joins us live now with the details. And Veronica, there's something new about the report this year.
That's right, Jay. For the first time ever, there's a profile for the city of Grand Rapids. And while the data shows that positive changes have been made, there's still room for improvement. Before the pandemic, great strides were being made in decreasing child and young adult poverty. But if you look closely at the new data set, it reveals that Grand Rapids has a lower median income than the rest of the state and county. And there are clear disparities between income and the high cost of housing in the city. About a third of Grand Rapids households are spending a disproportionate amount of their income on housing. According to the profile, Grand Rapids also has a higher percentage of children living in areas of what is considered concentrated poverty, something that made a big difference in pulling some families out of poverty, COVID-era policies like the federal child tax credit.
Let's continue. Let's continue some of those COVID era policies, particularly around the child tax credit and earned income tax credit, because it can make a difference for families today. And there are a number of other recommendations in the report that are short term in nature and gives us something to work towards and focus our effort to really move the needle and improve child well-being.
On a positive note, the report does point out that new investments in building affordable housing are being made at the city and county level, but more housing for low and moderate income households needs to be built in opportunity-rich areas with access to good-paying jobs and strong schools. Another highlight from the report, more kids in Grand Rapids are being tested for lead than in other parts of the state, which is a good thing because that means that those with elevated blood lead levels are getting the care they need. Jay?